那个旁个그 남자친구가 친구
说他对，
Okay, so just is there any one of you did not write your attendance yet?
Yeah.
Everyone here? So 1, 2, 3. Okay. So our lesson today is about CHCCOM005. Okay, it's communicate and work and health or community services. So with this title, why do we need to learn how to communicate? Okay, why is it necessary for the nurses to learn to communicate? Okay, so we came from different background. Okay, the essence of learning how to convey your message to your patient or to your client, because sometimes we have we came from different background, and sometimes our tone, for example, if you talk to me, sometimes your voice are raising up. I may thought that you are getting mad. Okay. However, it's your culture. It's the way how you express your feelings. Okay. So learning to communicate is essential for the nurses so that we can deliver our message and we receive the message from our client correctly. Okay? So the objective of this lecture is to discover how to communicate effectively with people. As I have mentioned, we came from different backgrounds, and sometimes my tone is high that you may think that I am getting mad on you. However, it's my culture. Okay? Know how to collaborate with colleagues, how to communicate with other staff. Okay? Learn how to address constraint to communication. Understand how to report problems to your supervisor. Ascertain how to complete workplace correspondence and documentation. Okay? Identify how to contribute to continuous improvement and gain the skills and knowledge required for this unit. Okay. So under this we have use verbal and nonverbal communication to enhance understanding and demonstrate respect. Okay. Okay, verbal communication includes spoken words, the way how we speak, formal or informal speech, differences in tone, as I have mentioned. Okay, I may talking to you sometimes. I'm raising my voice that you may think that I am getting mad on you. However, it's my culture, same as your culture. Okay, volume and speed. Okay. Non-verbal communication can include body language, gesture, sign language, facial expressions, written words, using images or graphics. Okay, so for the nurses, why we need to learn how to observe the body language of our patients? Okay, why do we need to learn the gesture? Why do we need to learn the facial expression of our patient? Okay, sometimes our patient may tell you, I am in pain. Okay, once the patient tells you that she or he is in pain, as a nurse who are looking after that particular resident, you should also know how to assess if the patient is really in pain. If the patient will tell you, I am in pain, you need to observe the facial expression of your patient. How does it pain looks like? What kind of pain is the patient is having? So those are the things that you need to ask to your patient. You need to observe if the patient is telling you that he or she is in pain. You also need to observe the facial expression of your patient. And ask the patient in a scale of 1 to 10, 10 is the highest degree of pain, which is the pain with regards to intensity. Okay? From 0 is non-pain to 10. So if the patient will tell you, I with the scale of 10, my pain is 9. Okay. And you also need to observe the facial expression if the patient is also, if the facial expression is, what do you call this? Is if the facial expression of your patient is really in pain. Are they is grimacing, the facial is grimacing while the patient is having pain? The duration, how long it takes, and how often the pain occurs. Those are the things that you need to assess to your patient. Okay? Written words, okay? And using images or graphics. You will ask the patient, this is the pictures of pain, which is the level of pain that you are having at the moment. Okay? Harold Laswell developed a model of communication to show the process in its simplest form as it applies to everyday interaction. This follows at who the communication, says what the message, in which channel, okay, to whom the receiver, or with what if or the effect. Okay. So as I have mentioned, we came from different backgrounds. You guys from Korea, you guys from China, and I'm from Philippines. Okay? So what effect you may, okay, tell me that I don't understand. Okay? If I am in a group of people and you guys are talking to your own language and I cannot understand what you are talking, I might feel isolated and I might feel not belong to your group. Okay? So that is the communication. If you want to build a good relationship with your client, with your patients, okay? If even though you are both from the same country, when you are in front of your patient and your patient came from other culture and coming from other background, okay, you need to speak the language which your patient can understand. It's very important because if you will be talking to each other and in front of your patient, that your patient cannot understand what you are talking, the patient might think that you're talking something about her. And you cannot build a good relationship with your patient because the trust has already been compromised. Okay? It's very important that when you are in front of your patient, talk the language that your patient can understand. Okay? Next, communicate service information in a manner that is clear and easily understood. All right. Service information may be a simple communication of appointment, times, or directing people through service, or you may handle patient client information that is confidential and vital to the care they may be receiving. Okay. Whatever information you gather coming from your patient, make sure that you will treat it confidential. Do not share the information coming from your patient to those people who don't have any business with regards to the care that your patients need to receive. Okay? Treat it as a confidential. Do not share it to the other, not unless those people are involved with delivery of care to that particular person. You understand what I mean? How I wish I could translate. Okay? Do you understand? Okay. I mean, when you get information from your patient, okay, treat it as a confidential. Confidential means do not share to anyone, especially for those people who are not involved, who don't have any business to that patient. Do you understand? Oh, we have a problem with this.
Translate from Chinese.
Okay, do you understand?
Chinese. Chinese 很少，我跟我们去。Go ahead. Keep going. 没关系啊，没关系。
Okay, I repeat. Okay, if I get information from my patient, okay, I need to gather information. That information must be treated confidential, and it should not be shared to those people who don't have any business to that particular patient. You understand?
他说没有，拿出那个你。
No, it's alright. It's alright. Okay, we may have a problem later on. As I said, service information may be simple communication of appointment times or directing people through the service, or you may handle patient client information that is confidential and vital to the care of your patient. Okay? So it means whatever information you get coming from your patient, okay, treat it as a confidential. Or as a nurse, it's good if you are good in assessing, getting the information. For example, the patient is having pain. So what part of your body is having pain? Okay. Okay, next. Improve your communication by listening skills such as active and reflective listening. So what is active and reflective listening? If the patient will tell you, okay, I am having pain, okay, you as a nurse will ask your patient, you mean you're having pain? Okay, what type of pain you're having? What part of your body is having pain? So those are the things that you need to ask to your patient. It means that you are attentively listening to what your patient is telling you. Okay? Being mindful of others' people emotion. Showing empathy for others' situation. Use encouragement to help the client to speak, or use encouragement to help the speaker to relay their communication message. Use affirmation to help your skills. Oh, what happened? Okay, still loading. Wait. Yeah, it's downloading, but
Are you recording now
yeah,
for class?
because I am applying in uni,
Ah.
so they need some proof how I deliver my lecture.
That's right.
좋긴 좋은데 사실 중국어는 안 좋지. 중국어는 안 돼.
To check your student learner's workbook,
Okay.
and make sure that your name is there. That's what you have done last week. Okay. Name, all your contact information. And on the third page, okay, you also still have your name there and today's date. Okay. No, just ignore it.
Okay.
And here, okay. Can I see yours? And also here. Okay, your name and today's date. Here, your name is today's date. Okay. Here, your name, address, email address. Okay. Thank you. Okay, so next is confirm the person's understanding. So when you are talking to your patient and they are telling you something, for example, I am having stomach pain. Okay, so confirm person's understanding means if you give some information to your patient, you need to ask your patient, do you understand what I said? Do you understand what I mean? For example, the patient will take the medicine. This is your medicine for hypertension, and this medicine must be taken with full stomach. Okay, this medicine must be taken before bedtime. Okay, so you need to confirm to the patient if the patient understand what you have said. If the patient understood, okay, so okay, what medicine is this? Do you understand what I said? And then the patient will say sometimes yes. Okay, this medicine is for what medicine is this? Okay, and the patient will tell you this medicine is for my hypertension. And what time do you need to take this medicine? So I need to take this before bedtime with full stomach. It means that the patient understood what you have said. Okay? Then ask if information has been understood. Okay? Check if further information is required. Okay? If the patient has an hesitation, then you need to reinforce. Okay, I repeat, this is the medicine for hypertension. It must be taken with full stomach during bedtime. Okay, and you still need to ask the patient if the patient understood what you have told to him or to her. Okay, repeat key points information, encourage a discussion to confirm that understanding has been made. Provide support written information. Okay? So in Australia, they are very keen with regards to that scenario. Okay? Aside from what they have told you, aside from what orientation the nurses given to the patient, they give the patient what do you call this? Some information. Note information that the patients need to read. Okay? So that the patient can fully understand what those information is all about. Okay? An open-ended question is essential. An structured question that allows the patient to answer in their own way and with their own words. They should lead others to think analytically and to reflect. Okay? In your communications, the use of summary can greatly assist in relaying information and facts to required individuals. A summary should contain the essential points that are required for an understanding to be made. Okay, so after the discussion, the nurse will tell to the patient. Okay, just a recap on what we have discussed. Okay, the nurse will check, we already discussed this thing, and this is need to be done for like this, and this medicine needs to take with full stomach during bedtime. This is for the hypertension. All that you have discussed, then the nurse need to summarize, to sum up all those things, just to ensure that the patient understood of what you have discussed during the consultation or during the nursing health teaching. Okay? Listen to request clarify meaning, and respond appropriately. Then, reflecting can be performed through monitoring. Repeat back the key phrase or words. Paraphrasing, use your own words to repeat what has been said. Okay, so you need to ask the patient, did you understand what we have discussed? Okay, what we have discussed, can you please tell me? That's the only thing that you will know if the patients really understood of what you have discussed. Okay, and it's very important for the nurse to know that the patients fully understood of what you have discussed on. Okay, because some of the patients will say, okay, I already understand. Okay, I already knew. Okay, and then when they went home, they don't know what they need to do. Okay, as a nurse, it's really important for us to ensure that the patient has a fully knowledge of what they are going to do when especially if the patient is need to go home. And the patient has a lot of medicines to take. Okay? Motivational interviewing is working with someone to help them to come to their own decision. Coercion is influencing another in making decision. Okay, collaboration and confrontation. Collaboration is the coming together of two or more persons to work together for the mutual benefit of involved. Confrontation is where two or more persons who come together clash and disagree over the subject. Okay, question. Sorry, we don't have the interpreter here, not like last week. Last week we have a good discussion because someone needs to interpret from English to Chinese. Okay? But now they did not come. So next, exchange information clearly in a timely manner within confidentiality procedures. Under this we have, once information has been given or obtained, make sure you pass this to the correct persons as required by your organization's procedures. This should be assessed and correctly identified for the intended recipient. Okay, so you already have an interaction with your patient and you already gathered the data of your patient. Of course, when the nurse gathered information, those informations need to be filed in the patient's folder. So that when the doctors came, the doctors will only read the information that you have gathered, and most of the time the doctors rely on the information that you gathered coming from your patient. Okay? So as a nurse, it's very important for us to ensure that what we have gathered is accurately correct. Okay? Confidentiality of communication, as I have discussed, any sensitive information, whether it is about the organization or a client, should always be treated appropriately. If in doubt, on the other, caution, you may never be to be careful. You need to be careful. Okay, as I have mentioned, you need to ensure that all the information that you gathered from your patients must be confidential, and it can only share to those people who are involved with regards to the care of that specific patient. Next, confidentiality covers physical privacy of patient in the facility. Controlling, not sharing records, monitoring access to records, disclosure to third parties, use of audit trails, etc. So, patient controlling, not sharing with records, I already mentioned. Monitor access to record, disclosure to the third parties. If it is needed by the doctors, then the doctor has the right and authority to know the situation of your patient. Okay? Physical privacy of patient in the facility. If you are undressing your patient, make sure that the door is closed, the curtain is closed to ensure the privacy of your patient. Next, listen to clarify and agree time frames for carrying out of workplace. Okay. Under this, we have apply workplace protocol and procedures. Clarify the following points. What task you need to complete. Deadline for this task. Sequential order of this task. Expected length of this task. Documentation requirements. Required equipment. Required safety procedures. Okay. When you report to your shift, for example, you will be working 6 to 2 p.m. Okay, all the morning cares must be done in the morning shift. Okay, and those tasks that you need to your patient has a time frame. Okay, before 7:30, all your patients must be ready for breakfast. Okay, and you given patients a minimum of 5 to 7. Okay, you need to manage your time because there's always a time frame to each patient. As a nurse who will be looking after the 7 patients, you need to know which among the patient is easy to manage and then do it first. Okay, and leave behind those patients who really needs 2 persons assist. Okay? Do the first easy residence so that you can manage, okay, to your patients to be ready before 7:30. And left behind those residents or patients who are difficult to manage. For those patients who really needs to be assisted by 2 persons, do it last. Okay? Question. Take messages. Ensure you take the following information. Who the message is for, who the message is from, contact details of the sender, the message content, the time and date of the message, your details and your contact, your details if the receiver needs to contact you for clarification. So, okay, so if in healthcare facility, especially in the nursing home, we need to communicate to the doctors. Okay? Especially if you notice some changes to your patient, then you need to document all those things and inform the supervisor and through messages. Okay, it's either email or or in patient progress notes. Okay, so all the things that you have noticed must be reported to your supervisor. Okay? Okay, scope of practice. Your scope of practice refers to the actions and procedures that you are permitted to undertake and usually referred to licensed individuals such as nurses and paramedics. It generally refers to what you are licensed to do through unlicensed workers who have restriction placed on the actions they can do. Okay, so when you commence your work in the healthcare facility, you have the duties and responsibilities. It is important for you to know up to what extent, okay, you can give services to your patient. If it is not within the scope of your practice, then do not do it. Okay? If it is not within the scope of practice that you need to do not do it. Okay? Identify lines of communication between organization and other services. Under this, we have working with other sectors of the industry. Some examples of different sectors may be aged care, alcohol and other drugs, child protection, children's services, community development, community work, disability services, and etc. So roles of other organizations may include knowledge and understanding of other aspects of care. Industry sectors can enable you to put together a service package for the client and to ensure that they are receive all the help that they need and want. Okay. So the reason why those elderly is decided to be in the nursing home because they need someone who are expert and giving the care for the elderly because their family can no longer look after them. Okay? Organizations in the healthcare system in Australia. Okay, public hospitals, private hospitals, health professionals, private practitioners, clinics, government agencies, and non-government agencies. So, identify networks. We have, in most cases, you'll need to communicate with and establish the effectiveness of several potential or existing networks to achieve your goals. And then next is use industry terminology correctly in verbal, written, and digital communication. Okay, organizational requirements for communication. We have this usually refers to the communication of information between staff concerning a patient, an event, an issue, or any other workplace information. Industry terminology. Okay. Always familiarize yourself with the correct industry terminology in use of your organization and for the services that you provide to others. Okay. Follow communication protocols that apply to interaction with different people and lines of authority. Under that, we have friendly communication. Okay. Communication should be inclusive and clear for all concerned, especially in the care profession. Communication that is person-centered or community-centered can have a positive effect upon the person or group involved. Okay. Next is client-centered approach to healthcare. We have putting patients and carers at the center of service delivery. When the patient is a child or young person, service delivery strategies may need to be modified to ensure child safety and provide a child-friendly supportive environment, etc. Correct protocol. You should always ensure you follow the correct protocols for your communication. Each group or type of person will have their own set of protocol for performing workplace communication. Okay? Next, cultural sensitive communication. In order to show respect for those from different cultures that we may work with, we need to display culturally sensitive communication. Okay, if you will be looking after other patients coming from different background, it's very important for the nurses to have an idea, okay, what background your patient will be looked after. And you have at least an idea what culture they have, how they practice their faith, okay, so that you can fully understand and be able to get a good or build a good rapport to your patient. Okay, knowing the culture of your patient can give you more efficient care that you need to give. Okay, because we cannot impose what we believe in. Okay, as I have mentioned a while ago, we will be dealing different types of people and different people coming from different background. Okay, address constraint to communication.